Let's talk training your core during pregnancy, because no doubt you're probably confused about what exercises are safe when it comes to training your core during pregnancy. You may even be avoiding training your core altogether because you're scared it will hurt your baby, that it might strain your abdominals or cause abdominal separation. And who knows, you might be in the other camp where you've been told that you can continue training your core and doing crunches exactly the same as you did prior to your pregnancy, and that anyone telling you different is just fear-mongering. But trust me, when it comes to training your core during pregnancy, it's like the Wild West out there, with more contradictory and conflicting misinformation than ever before. So if any of these sound familiar to you, keep listening, because in this short video, we'll break down the structure and function of your core, how pregnancy affects your core, as well as some safe and effective core exercises for pregnancy, with the key here being individualization and exercise selection. So let's dive in. And I think the best place to start is an analogy that I've heard explaining your core, which is probably the best one that I've heard, is that your core is like an upside down water bottle. At the top is your diaphragm, the bottom your pelvic floor, the back muscles called multifidus, and your transverse abdominis or TVA is a belt-like muscle that wraps around. And the top of your core is your diaphragm, which is instrumental in breathing and controlling intra-abdominal pressure. The bottom of your core is your pelvic floor, and its main function is to support the internal organs of the pelvis, including the bladder, uterus, and back passage. It also acts as a constrictor mechanism for the anal canal, vagina, and urethra. The multifidus muscles at the back help with the stabilization and fine movement of your spine. And the TVA is a corset-like muscle that wraps around your trunk, helping maintain abdominal tension, support internal organs, and help controlling intra-abdominal pressure. Now, I've done an entire video on intra-abdominal pressure and its importance, so I'm not going to dive too heavily into that in this particular video. But if you haven't watched that video, I absolutely suggest that you do. Now, as a whole unit, the main functions of the core are to protect the spine from excessive load, protect your abdominal organs, and help transfer force from upper to lower body and vice versa. And the natural role of our core is to resist movement, not create it. And it's also important to remember that the transverse abdominis, along with the diaphragm and your pelvic floor, play a significant role in the stability of your sacroiliac joint at the back of your pelvis. Now, on top of your core, you have your internal and external obliques, which are responsible for rotation of the trunk and lateral flexion. Above that, you have your rectus abdominis, otherwise known as your six-pack, which is responsible for flexion and extension of the trunk. So your rectus abdominis, internal and external obliques, all interlace into your linea alba, which tucks into your TVA, kind of like tucking a t-shirt into your jeans, right? But that is an important point. So the linea alba is a tendon-like band of fascia that runs from the bottom of your sternum to a joint at the front of your pelvis called the pubic symphysis. And the main function of the linea alba is to keep the abdominal muscles within a certain distance of each other. Another important thing to note is that your linea alba has a natural gap in it from your umbilicus or your belly button. So your umbilicus passes through the linea alba slightly below the midpoint and is what separates the two halves. And when I say halves, I don't mean it's split, but more the upper linea alba, which is wider and thinner, and the lower part, which is narrower. So we've just been through the muscles and function of the core and abdominals. We know what the linea alba is. Now let's talk about how pregnancy changes all of this. And before I go into all of this, I want you to remember that training your core, maintaining connection to it, and keeping your core strong during pregnancy actually helps with all of these things I'm about to go through. But the key is exercise selection and individualization, because what one person can do may not be appropriate for another. And as much as you're still so strong and capable during pregnancy, training your core during pregnancy likely doesn't include continuing to do what you've always done. And during pregnancy, your abdominal muscles, particularly the rectus abdominis, stretch significantly to accommodate your growing baby. There's also a decrease in the thickness of your core muscles as your pregnancy progresses. And these changes to your abdominal muscles can lead to abdominal separation. And you've also got the change in center of gravity, causing an anterior tilt of the pelvis, which can place more pressure on your core and lower back. Your pelvic floor muscles stretch and can weaken as they support the increasing weight of your baby. And in preparation for the birth, hormones cause the ligaments and muscles in the pelvis to become more lax, which can lead to pelvic instability. And being a supporting muscle in the pelvis, the pelvic floor can then be recruited to help stabilize the pelvis. Now, this can have an overloading effect on the pelvic floor. Pregnancy also naturally increases intra-abdominal pressure and can cause changes in core muscle co-activation. The diaphragm shifts, which again being the top of your core, has a flow-on effect to how your core functions as a whole. So when you take all of this into consideration, you can understand why some people are too scared to train their core during pregnancy. But remember, these changes are completely normal and necessary for your growing baby. They're also why targeted core training using individualized exercise selection that takes into consideration your training age and experience is so important when it comes to training your core during pregnancy. Because correctly training your core during pregnancy can actually help minimize abdominal separation. It can help reduce back pain and pelvic pain and lead to improved labor and delivery outcomes. But when it comes to maintaining connection to your core during pregnancy, the key thing to remember is the natural role of our core is to resist movement, not create it. And the core, in essence, is anti-rotational, anti-extension, anti-flexion, and anti-lateral flexion. And to truly maintain connection to it during pregnancy, we must not only focus on these types of movements, but increase your strength in them. So let me show you some of my favorite pregnancy safe core exercises that sit in the anti space. And we're going to start with anti-rotation. And as the name implies, anti-rotational movement focuses on preventing motion at the hips and spine while allowing the limbs to move. And a great example of these would be your pull-off press variations, which are an absolute staple in all of my pregnancy and postnatal programming. Then, of course, you have anti-extension. So anti-extension is a very important movement to train during pregnancy due to the lengthening of rectus abdominis and the anterior pelvic tilt. And it also helps teach you to control your core and stop going into extension, which during pregnancy can place pressure on the abdominal wall. And a great exercise I use for this is your kneeling lean back. Moving into anti-lateral flexion, so understanding your obliques act to resist motion and maintain proper hip and core position. So working anti-lateral flexion or bending is a perfect way to strengthen these muscles and protect the spine. And an exercise I love for this during pregnancy is a single arm farmer's carry. And last but not least, anti-flexion. So anti-flexion works the extensor muscles of the back side or posterior side of your body. And one of my go-to exercises for this during pregnancy is your 45-degree back extension isometric holds. But remember, proper form is crucial in all of these. You should always focus on breathing correctly and maintaining neutral intra-abdominal pressure. And you shouldn't see any bulging, doming, or peaking of your abdomen during these exercises. And if you're not sure what I mean or how to do this, my advice to you would be to seek the help of a professional coach or feel free to reach out to me. So there you have it. Training your core during pregnancy isn't just safe, it's beneficial when done correctly. But the key takeaways that I really want you to consider when training your core during pregnancy is that your core is a complex system that undergoes significant change during pregnancy. And that targeted core training can help minimize the impact of pregnancy on your physical body and prepare you for labor. And to focus on exercises that resist movement rather than create it. And most importantly, please remember, every pregnancy is unique. So what works for one person might not work for another. And this is why individualized guidance is so important. And I really hope this video helps you make more informed decisions about training during pregnancy. Of course, I'd love to hear your thoughts on this, so feel free to drop me a comment below. And if you'd like more in-depth pregnancy-specific information, feel free to apply to my complimentary but private community, the Preggy Training Crew. The link is in my bio.